the thought of replacing brain cells is very attractive, and there have been some attempts, and the main field really is Parkinson's disease. And what they've done is they've taken fetal tissue from fetuses that come from humans, human-aborted fetal tissue mostly, at about 14 weeks. And that tissue, the brain tissue, is dissected out, and the piece of brain that makes the dopamine neurons that die in Parkinson's is basically trypsinized in the petri dish and then transferred over into the patient. And they've done up to 350 transplants of these fetal dopamine neurons. And the question is whether they're working. And I think the evidence is actually that overall, that although there's some spectacular patients who seem to be doing well, the double-blind studies have not shown efficacy in most cases. And there are some issues with side effects called runaway dyskinesias. And what that means is movements that are uncontrolled, almost like Huntington's disease, but in a Parkinson's patient, or like they look when they're having too much L-DOPA. So these dyskinesias are caused by the transplant. And it may be my rationale for saying that I don't think these neurons are going to work is that this is a major issue, and that you're putting the cells actually into the wrong part of the brain. The neurons that die in Parkinson's are deep in the brainstem, but you can't transplant them back there, because if you do, they don't reconnect properly. And so what they do is a shortcut. They transplant them into the striatum, which is where their innovation is. And there they can make connects with their target, but it's ectopic. They're outside where they should be. And I believe that they're not going to produce the right kinds of effects we're looking for in patients. And so it's a real challenge. Now, I'm very sympathetic to the field. It's been remarkable, and it's taught us an enormous amount about how fetal neurons can survive in a human brain. That's been valuable for the field. But whether or not this is going to be a new therapy for Parkinson's, I'm somewhat skeptical. I think we need to do more experiments to get the neurons back in the brainstem and make a real connection, because the brain is a circuit, and that's the challenge.